Are you experiencing unusual symptoms at night? If so, it might be your body trying to warn you about something serious. In today's video, we're discussing 9 nighttime signs of diabetes that you should never ignore. These signs can be easy to miss, but recognizing them early could help you manage or even prevent diabetes complications. Stick around until the end for crucial advice on how to take action. Before we dive into the signs, let's briefly explain what diabetes is. Diabetes is a chronic condition that affects how your body processes glucose, or sugar, in the blood. There are 2 main types of diabetes. Type 1 diabetes is an autoimmune condition where the body attacks the cells in the pancreas that produce insulin, while type 2 diabetes occurs when the body becomes resistant to insulin or doesn't produce enough. Both types can lead to high blood sugar levels, which, if left unchecked, can cause serious damage to various organs and systems in the body. Now, let's explore the nighttime signs that could indicate your blood sugar is out of control. 1. Frequent urination. One of the most common nighttime signs of diabetes is frequent urination, also known as nocturia. This happens because high blood sugar forces your kidneys to work overtime to filter and remove excess glucose from your blood. As a result, you'll find yourself waking up often to use the bathroom. Studies like one published in Diabetes Care show that people with high blood sugar levels are more likely to experience frequent nighttime urination. This isn't just inconvenient, it's a sign that diabetes may not be well controlled. If you find yourself getting up multiple times during the night to urinate, it could be linked to diabetes. Be sure to check your blood sugar levels and consult your doctor if this becomes a regular occurrence. 2. Excessive thirst. Another key nighttime sign of diabetes is excessive thirst, also known as polydipsia. This often goes hand in hand with frequent urination. As your body loses more water in an attempt to flush out excess sugar, you'll start feeling incredibly thirsty, even after drinking large amounts of water. According to research from the Journal of Clinical Endocrinology, excessive thirst is one of the earliest signs of diabetes. If you wake up in the middle of the night with an intense need to drink water, it might be a result of high blood sugar levels. If you're constantly thirsty during the night, it could be a sign that diabetes is affecting your body's fluid balance. Pay attention to this symptom and take action if it persists. 3. Night sweats. Waking up drenched in sweat can also be connected to diabetes, specifically low blood sugar or hypoglycemia. This can occur if your blood sugar drops too low during the night, often due to insulin or certain medications used to manage diabetes. A study in the Journal of Diabetes and Its Complications found that night sweats are commonly linked to episodes of low blood sugar in people with diabetes. When your glucose levels drop too low, your body reacts by releasing stress hormones, which can lead to sweating. If you frequently wake up with night sweats, this could be a sign of blood sugar imbalances due to diabetes. Be sure to monitor your blood sugar levels and speak with your healthcare provider if this continues. 4. Restless Leg Syndrome. Restless Leg Syndrome, or RLS, is another nighttime symptom often associated with diabetes. Many people with diabetes experience uncomfortable sensations in their legs, often described as crawling, tingling, or an urge to move their legs, especially at night. Research published in the Diabetes Journal points to nerve damage, or diabetic neuropathy, as a common cause of RLS in people with diabetes. When blood sugar levels are consistently high, it can damage the nerves, leading to symptoms like restless leg syndrome. If you have RLS, especially if it's disturbing your sleep, it may be tied to diabetic nerve damage. Consult your doctor about managing this condition alongside your diabetes treatment. 5. Fatigue or trouble. Sleeping feeling exhausted or having trouble sleeping could be a result of diabetes, especially if your blood sugar levels fluctuate throughout the night. High or low blood sugar can cause discomfort, restlessness, and poor sleep quality, leaving you feeling tired even after a full night's rest. A study from Sleep Medicine Reviews highlights that sleep disturbances are more common in people with diabetes due to blood sugar imbalances. These fluctuations can trigger frequent wake-ups or make it hard to fall asleep in the first place. If you're consistently tired or have difficulty staying asleep, it may be an indicator that your diabetes is not well managed. Be mindful of how your sleep patterns are affected and consider talking to your doctor. 6. Tingling or numbness. Tingling or numbness in your hands and feet, known as diabetic neuropathy, is another common nighttime sign of diabetes. High blood sugar damages the nerves, often leading to these uncomfortable sensations, which tend to worsen at night. According to the National Institute of Diabetes and Digestive and Kidney Diseases, about 50% of people with diabetes will experience some form of neuropathy. The tingling, numbness, or burning sensations often become more noticeable at night. If you experience tingling or numbness at night, this is a direct sign of diabetes-related nerve damage. It's important to control your blood sugar to prevent this condition from worsening. 7. Unexplained weight loss. Unexplained weight loss can be a serious sign of diabetes, especially if you're losing weight without trying. This happens because, without enough insulin, your body starts breaking down fat and muscle to use as energy, leading to rapid weight loss. Research from Diabetes Spectrum confirms that unexplained weight loss is a clear indicator of uncontrolled diabetes. It's your body's way of signaling that it's not able to use glucose for energy effectively. If you're losing weight without explanation, this is a sign of diabetes. Make sure to get your blood sugar levels tested and consult your doctor. 8. Slow healing of cuts and wounds. Another nighttime sign of diabetes is slow healing of cuts and wounds. High blood sugar affects your body's ability to heal by damaging your blood vessels and immune system, leading to slower recovery from injuries. A study published in the Journal of Clinical Endocrinology and Metabolism points out that people with diabetes are more prone to infections and slow healing, especially in the extremities like feet and legs. If you notice that even minor cuts are taking too long to heal, this also is a sign of diabetes affecting your circulation and immune response. Be sure to monitor this closely and seek medical advice. 9. Sleep apnea. Lastly, sleep apnea is closely linked to diabetes. If you find yourself snoring loudly or waking up feeling tired, this could be a sign that sleep apnea is affecting your sleep quality, something that's common in people with diabetes. Research from the Journal of Diabetes Investigation highlights that people with diabetes are more likely to have sleep apnea, which not only disrupts sleep, but also worsens blood sugar control. If you suspect you have sleep apnea, this could be a sign of underlying diabetes affecting your respiratory health. Getting tested and treated can improve both your sleep and blood sugar levels. Now that you're aware of these 9 diabetes nighttime signs, what can you do about them? First, keep track of your blood sugar levels regularly, especially before bed. If you notice any of these symptoms, consult your healthcare provider as soon as possible to adjust your treatment plan. In addition, it's important to adopt a healthy lifestyle. This includes eating a balanced diet, staying physically active, and managing your stress levels. Even simple changes, like eating smaller meals at night or improving your sleep hygiene, can have a big impact on your health. And don't forget, early intervention is key. Ignoring these symptoms could lead to serious complications, so make sure to act if you notice anything unusual. If this video was helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe to our channel for more health tips.